Hello everyone. Very good evening to everyone. My name is Devjani Chaudhary. I'm studying in Lovely Professional University. I'm master first year student. I'm doing masters in geography. So as a student of geography, today I would like to do a short session with you all on a topic climate change and India's health crisis. You can see here over I have added some slides. On those slides, I have added some of graphic pictures so that you can go through a deep understanding about the topic. So let's begin with the topic. In this session, I will cover some of the important subtopics like due to climate change, how it affects our health. It will so I will take upon the diseases, about the malnutrition problem and vulnerable populations problem. So let's begin with our today's topic. Um, First of all, I would like to give you a small introduction about climate change, like what we actually mean by climate change. What is a climate change? These climate change refers to a long-term shifts in global or regional climate patterns, primarily caused by human activities like such as burning fossil fuels, deforestation, and industrial process. These activities increase greenhouse gases such as carbon dioxide and methane, which trap heat in the Earth atmosphere and lead to rising global temperatures. Okay, so the key aspect in the climate change we can see that is the global warming, sea level rise, and extreme weather and ecosystem disruption, and also ocean acidification. The causes of climate change, that is mainly human activities. Okay, as I have already said in introduction, like because of due to the burning fossil fuels, deforestation, industrial emissions, and agriculture practices, and the natural causes due to which climate pattern change, that is the volcanic eruption, solar variations, and natural carbon cycle changes, though their impact is much smaller compared to human activities. Okay, so we will begin with our today's important discussion, that is how climate change is affecting our health. Okay, so you can see here over there I have added one picture for your better understanding. That is it is showing over there, like because of rising of temperature, the agriculture is the agricultural land is really so dry, the droughtness we can see. Okay, then children are getting sick. In that picture it is showing over like that. Okay, so technically if we speak, that is climate change is worsening India's health crisis by increasing the spread of diseases, worsening malnutrition, and disproportionately affecting vulnerable populations, rising temperature, changing rainfall patterns, and extreme weather event disrupt healthcare access and food security. So next we will see what are those diseases that is caused by climate changes. Okay, so see here there is a picture, you can get a basic understanding or like from the pictures over there, that is of because of high rise in temperature and due to the long time contamination of water that give birth to a mosquitoes that cause dengue fever. So so we will see what are those diseases. One, that is vector borne disease, second that is waterborne disease, and the third that is heat related illness. Okay, so the vector borne disease, how it is really caused? It caused due to the increase of cases of dengue, malaria. Okay, and the waterborne disease, as I have said, like because of contaminated water leads to cholera and diarrhea. And heat related illness, that is rising temperature cause heat stroke and dehydration. The third, we will talk about the malnutrition crisis. uh, Here also I have added pictures. So how climate change can cause malnutrition crisis? Because of crop failures, reduce food production, lead to food insecurity, increase rate of malnutrition and stunt growth, and micronutrient deficiencies due to declining crop nutritional equality. That's how climate change affects our agriculture activities, due to where due to due to that uh, crisis, it leads to malnutrition crisis. Okay, so the next we will know about the vulnerable population. Here, the the poor and the rural communities have limited access to healthcare. Okay, children and elderly are more susceptible to malnutrition and diseases, and marginalized groups suffer from climate induced displacement and resource scarcity. That we everyone knows, because of climate change, uh, the marginalized group, though they suffer from climate change. Okay, and induced displacement, and the resource also gets scarce. Okay, there's a scarceness of resource. The lastly, we will discuss about the government policies and the responses that can be a pillar or a support to reduce those um, crises, which are which are the deficiencies of climate change. That is, okay, government policies. We will see the responses of government, how they took the initiative to upcome those events, those healthcare crises, those vulnerable populations, malnutrition crisis. We will see the government policies and rules that they have structured to upcome these events, like National Action Plan on Climate Change, that is NAPCC. Okay, that is a state policies, strengthening public healthcare systems, and vaccination drives also, sustainable agriculture policies, and food security programs. All those policies and all those responses, due to all those regulations, we can upcome all the crises that are mainly caused by the climate change. And the last is the recommendations. Okay, I would like to conclude here with the for the topic today, that is enhancing climate resiliences in healthcare infrastructure, improve nutrition program and food security measures, strengthening public awareness and community lead adaptation strategies. So, thank you. That's all from my side. Um, I hope so. This session will be grateful to you all. Thank you.